Hi everyone, I am Dr. Saptarshi Ghosh, consultant clinical oncologist from Hope and Hill Cancer Hospital and Research Center, Fulbari. So today I am going to talk a little bit about pain management in cancer patients. So the basic of pain management comes from the WHO pain ladder, which we follow while managing pain in cancer patients. So it's a step ladder pattern of thing where we give the analgesics according to the pain, and we start with the lowest level and increase gradually if the pain doesn't subside with the lowest level of painkillers. So the lowest level of painkillers are with the analgesics known as non-steroidal anti-inflammatory drugs, and along with that we can also use some adjuvant agents like there is something called pregabalin and dexamethasone. So dexamethasone is a steroid, pregabalin is there. So these are few agents which we can use. So basically non-opioid analgesics is the first step of pain ladder, WHO pain ladder. So if the pain doesn't get subsided by this first step, then we aggravate to the next step, which is weak opioids plus these other agents. So weak opioids means it may be codeine, it may be tramadol, it may be tapentadol. So these are the agents which come under the weak opioid analgesics, and along with that we add on some paracetamol or some dexamethasone or some pregabalin and all to control the pain. So if the second ladder also fails to control the pain in cancer patients, then we go to the third level, which is the strong opioids. Under the strong opioids comes the morphine and fentanyl. We in Hope and Hill Cancer Hospital regularly use these opioid analgesics in severe intractable cancer patients with pain. So, and we do take care of them. This is a cancer institute where we have a palliative department for the first time in North Bengal. We have a palliative and pain management section where we typically take care of the patients with metastatic disease, with end of life care, and we do take care of them. So that's the third ladder where we use the morphine or the fentanyl patches. So morphine is something which has some side effects along with it. So all the clinicians, all the people around who are taking morphine should know that morphine does have some nausea and vomiting with it, and along with it, it also causes constipation. Sometimes it may be very severe. So along with morphine, the doctor generally prescribes the antiemetics like Reglan or something like Primafin Plus for the constipation, or Dufalac. So these two things should be taken care of while using morphine. And in patients whose liver function is not so good and whose renal function is not so good, suppose the creatinine is very much elevated, or there is a severe jaundice, or the liver function tests are not so good. In these kind of cases, in these kind of patients, we do use the fentanyl. We do prefer fentanyl over morphine because fentanyl doesn't require the metabolism through the hepatic, and it doesn't need the kidneys to excrete it. So we do use the fentanyl patches in these cases. So I would be thankful to you always for referring to me for the palliative and pain management things. And every cancer patient is special to us, and end of life care is very important, and it should be addressed properly in North Bengal. So I wish you all a cancer-free life, a happy and healthy life, and I wish you that nobody has to come or go through this terrible disease, but we have to stay strong and we have to help others who are suffering from the disease. Thank you.